There still aren't enough healthcare providers in Idaho.
Most counties are federally designated health professional shortage areas. Nearly 99% of our state experiencing the shortage, according to the Idaho Department of Health and Welfare.
The CDC lists the state as the worst in the nation for the number of doctors per 10,000 people, at 19 in 2019. More recently, though, in 2021, the University of Washington finding just 6 primary care doctors per 10,000 people. Much worse. Now, the shortage of healthcare providers for women, especially pregnant women, quite alarming. Between the enactment of Idaho's near total abortion ban in August 2022 and February 2024, 22% of the state's OBGYNs left, with only 2 moving in. Number coming from the Idaho Physician Wellbeing Action Collaborative's latest report. Now, the 2 years in that time frame, several hospital labor and delivery units closing too, like in Caldwell, Emmett, and Sandpoint.
Idaho's homegrown medical school trying to tackle the need, and for students, it's a life-changing moment. Today, the Idaho College of Osteopathic Medicine celebrating Match Day, an emotional milestone determining where soon-to-be doctors will begin their careers. Our Sophia Damani reports.
Today is 4 years in the making. Idaho's future doctors finding where they'll take their next steps.
3, 2, 1.
Match Day is when medical students learn where they'll begin their residency training. At the Idaho College of Osteopathic Medicine, or ICOM, this day carries extra weight. Idaho has one of the lowest physician-to-patient ratios in the country, and these students represent a critical step in filling that gap.
Idaho is a wonderful state, and I really hope that more doctors come and stay here. I'm really proud to be one of our primary care doctors and to serve our community and to give back to them as much as they've given to me over the years.
Since opening in 2018, the school has graduated hundreds of new physicians, many of whom return to practice in rural communities.
The residency programs here in the state all have a rural aspect of them, so they're connected to rural communities, and a significant part of the residency will involve rural health care. And they're also in primary care specialties, or specialties that are really needed in the state: family medicine, internal medicine, psychiatry, and pediatrics.
The nationwide doctor shortage is hitting Idaho hard, particularly in rural areas. Experts say it's programs like ICOM that will help turn the tide, ensuring families have access to quality health care close to home.
It's definitely a personal spot for me because my entire family is from rural Idaho, and I've seen a lot of really crazy, horrible things that could have been prevented if we had more doctors in the state. So I definitely urge people to really buy into that populace, buy into those rural sites, and make sure that we can make a difference in those areas too.
For these students, Match Day is the start of their careers. For Idaho, it's a sign of hope that more doctors will stay and serve their communities. Reporting in Boise, I'm Sophia Damani.
At the Capitol, an amendment to a bill that could help Idaho gain more doctors instead of, as opponents worried, lose medical school spots. The bill would have cut at least 10 taxpayer-funded medical school seats at WWAMI, Idaho's decades-long partnership with the University of Washington School of Medicine and others, while adding 30 new seats in other programs over the next few years. The proposed amendment keeps the WWAMI seats open, making those cuts optional. Idaho Education News reports WWAMI alumni and students signed up to speak against the bill, now urging the committee to sign on to the amendments. If the Senate approves them, the bill returns to the House.
Idaho Capital Sun reporting Idaho's Budget Committee is shooting down an effort to help rural Idaho doctors pay off their medical debt. The request from Governor Brad Little would have set aside $500,000 to expand the Rural Physician Incentive Program, which provides $25,000 a year to help physicians who can provide medical care in federally recognized health professional shortage areas. Those in favor say it helps keep doctors here in Idaho, but the committee ultimately deciding to take it out of the budget plan. Meanwhile, Governor Little also signing off on a bill that allows healthcare professionals to deny care for non-emergency procedures that violate that doctor's religious or moral beliefs. Idaho Capital Sun reporting those behind the bill say it protects healthcare professionals from being forced to do things they don't agree with. But Planned Parenthood Alliance advocates argue it gives healthcare workers a license to discriminate and could put lives at risk. The bill could impact everything from health care for transgender patients to abortions. And with the health care shortage, it may be difficult to find a new doctor if one refuses care. The bill, now law, takes effect immediately through an emergency clause.
Doctors leaving the state partly blame Idaho's restrictive abortion laws. They say it complicates care decisions, forcing them to fly some pregnant women out of state. St. Luke's requesting a court order to temporarily allow doctors to continue providing abortions in emergencies. St. Luke's suing the state back in January, arguing the near total ban conflicts with federal law. Now a judge granting St. Luke's new injunction to block Idaho from prosecuting doctors for terminating a pregnancy as their case moves forward. Attorney General Raul Labrador wants the case dismissed. The Trump administration new mayor member dropping a similar Biden administration lawsuit against the Idaho bans. Now, this all happening as this year's maternal mortality review calls for increased access to care, plus education and more awareness among providers to save pregnant and postpartum lives. Like more mental health monitoring, more screening for hemorrhage, and more virtual care in rural areas. The review showing no medical errors or denial of care contributing to the 11 deaths in 2023. Data so far also shows 7 maternal deaths in 2021, 15 in 2022, and 5 in 2024. So we're seeing a drop. Lawmakers reinstating this committee last year after letting it expire after its 2021 report. Now, nonprofit Surgo Ventures shows Idaho with a moderate maternal vulnerability, with Ada and Vale counties among those with the lowest vulnerability, and Lewis and Owyhee counties with the highest, blaming this on a lack of reproductive care. Oregon shows low vulnerability, with Walla Walla County in the low end, but Malheur County with the highest vulnerability. In Oregon, the nonprofit blames socioeconomic factors. Now, infant mortality worsening in the states in the past year, according to March of Dimes, and about 1 in every 200 births here results in a stillbirth. That's more than 100 a year. A local bereaved mother recently shared her story with you here of stillbirth at 33 weeks. She hopes to encourage others to advocate for their pregnancy and baby.
I was drinking cold water and he wasn't moving, which is really unusual for him. That was when alarm bells started to go off in my head, but I thought that I was being an overly anxious, expectant parent, and everything was fine. Even if you can't really put your finger on why it is that you don't feel right, just go in, because that feeling of impending doom it's more accurate and more telling than any of us are aware of.
If stillbirth or miscarriage is a result, hospital systems like St. Luke's and St. Alphonsus offer grief support, memory and memorial options, special spaces, and follow-ups.
So if we know that baby may not survive delivery or long after delivery, trying to create a unique care plan, a birth plan for this family, what they want this to look like as best as we can, the meaningful aspects that we can bring into this family afterwards, allowing them time with their child, giving them resources, being respectful of what they need in that moment, I think has been a really unique perspective and really helpful for families.
As she and the other specialists in bereavement sitting next to her say there is no correct way or amount to grieve for pregnancy or infant loss. And these were just some snippets from the town hall I put together on infant and pregnancy loss, a half-hour discussion with local bereavement specialists from St. Alphonsus and St. Luke's. We've also got Angelica's full story of losing baby Ezra and how she continues to cope and helps others. You can find both these pieces on idahonews.com.